Good morning. Welcome to sunny California. This is part two of home and health insurance. And thank you for joining CCN channel. This is Consumers Doctor, Dr. Bengala, a non-profit entity to educate the public regarding insurance. Okay, you have insurance. This is your personal asset. Okay, how do you make money? You keep saying, how do you make money on healthcare? Yes, a lot of folks have no idea how to make money on healthcare. I'm giving you these tips. If you're individual, you're a solo, you're independent, you have your own business, there's money to be made, folks. And you are a blue collar worker, there's money to be made. You know, the blue collar, 160 million people have private insurance, so-called blue collar workers. They make average 55,000. You know, I calculated 160 million by, premium of roughly traditional insurance, 16, 18,000. It comes to 2.88 trillion. This money, you'll never see it year after year, year after year. Suppose you change that to a lower premium policy which qualifies. Lower premium in the sense you get a deductible policy. You are buying a home insurance, same if you have a deductible, whatever you can afford, 500, 1,000, 1,500. You're young. If you have 1,000 deductible, one paycheck, whatever it is, your policy will go down by 60 to 70%. That 60% of the policy, 60% of the premium, what you save, you can put it into your personal care accounts or health savings, and that is your money to keep for the rest of your life. It has triple benefits. Contribution is deductible. Withdrawals are deductible as you spend it on your medications or whatever it is. And interest, whatever the compounding, if it's in the market, that is tax-free. So there's a triple tax benefit, folks. If a person is young, if he saves $400 a month, you're talking about $4,800 at the year end, which is almost comes to $5,000. In 10 years, you'll have $50,000. You can't touch it though. That's one thing. That is, it forces you. They'll penalize you heavily if you touch that. There's a 20% penalty if you touch it. But that will penalize you. As a matter of fact, they might make it difficult for you to withdraw the money because it has to be for healthcare only. So that 50,000 in another 10 years will be 100,000. Another 10 years, 150 to 200,000. By the time you can retire at the age of 50 with 200,000 in your HSA, health savings accounts. Folks, this is what the money, you are saving the money. All right. Once you have the personal care accounts, they give you a debit card. It's almost like having a card. You pay whatever. For unforeseen circumstances, you have to pay for it, and you have the cushion. But the beauty is, you shop for the lower premium policy, whatever your affordability is. The more affordability you can share, the lower the premium. And even by bringing transparency, as the present administration is trying to do in insurance companies and hospitals. By bringing transparency in insurance companies and hospitals, what will happen is, and people they can go to a healthcare blue book, folks. Even the healthcare blue book, they'll give you the prices by the zip code. So I want you to subscribe to Healthcare Blue Book, which is another nonprofit entity. You will get prices for CAT scan, MRI, and look at the cash price. That is 70% lower. If you pay cash, tell them I have no insurance, I'm going to pay cash. You see the beauty is, this is where you come out ahead, folks. You really need to be smart. Average American consumers are smart. They know how to pinch a penny. They can save money. And Americans know how to handle their healthcare. We don't need anybody to tell us how to take care of your home, how to take care of your health. If I'm physically fit, Don't see a doctor. Don't see, if nowadays, even if you want to see a doctor and telehealth, you can get a doctor for $20, folks. I'm not kidding. You can talk to your doctor. If there's any question you have, talk to your doctor. Even they're empowering the doctors, empowering the doctors. What they're doing is, doctors who disclose their prices, they are being overloaded with patients. This is what will happen, the free enterprise. Doctors want more patients, they can sit at home, not having an overhead. They can see umpteen number of patients whom they want. They can make a lot more than sitting in the office and spending all this and all the overhead costs. 40% is overhead. You can save that 40%. So you will see a trend, changing trend. Even the healthcare professionals, they will not have to have an office. They don't need to have overhead. They need to just have the malpractice insurance and they're covered. And there has to be a cap. That's one thing we talked about, tort reform. There has to be a cap in medical malpractice, penalties, cap of 200, 250, whatever it is. That will really stimulate our healthcare and make our healthcare great. You cannot exploit emotions, and there's no price tag. The jury verdicts are all emotional based. We need to limit that. I know it's a very emotional issue when it comes to health, but we need to limit the damage. So everybody, even including hospitals and insurance, they have to have some cap, folks. That's why we can keep the premiums lower. Beauty about having healthcare, okay? You can get your medications, and also gives you a personal, and the drug addiction is so prevalent here in this country because the government was throwing money at this welfare community, and they go and spend the money because it's a free money. But when you have control on your own money, you don't do that. People get smarter. They don't want to waste money on drugs. They don't want to waste money on like high cholesterol items. They want to take care of their health. They want to take care of the blood pressure. They want to be physically fit. This is what I want to. I want to bring a change in common folks. Especially, I'm not talking about wealth. I'm talking about average folks. This is a money maker for average folks. I don't know. I don't know why people don't do that. I still don't. They want, government mandated. There's no choice. Whenever you're talking about this affordable care, it is not affordable care. It is basically, it's not anything to do with healthcare. This is all a control. They want to control you. As Abe Lincoln has said, this country, as a free enterprise country, can never be invaded from outside. It will be. It will be if you falter on freedom. They want to control you through Affordable Care Act. Folks, don't fall into that trap. I want you to own it, and I want you to be empowered. You're in the driver's seat. I don't want anybody, neither the insurance companies, nor the hospitals, nor the doctors. Americans are smarter. I am quite positive Americans will wake up one day and they will rise up in this healthcare, and we will be number one in healthcare. In spite of spending 19% of the GDP, 18 to 19, it has surpassed the defense budget. Folks, it has, India spends 1.5% of the GDP. What's wrong with us? We are wasting all that money. And India provides the best care because they have a tier system. I don't want that tier system. I want everybody to be empowered. They can come out ahead. That's where the free-spirited American enterprise like Amazons and Googles, we want common folks to enrich themselves. Thank you for joining again, CCN channel. Consumers Doctor, a non-profit entity. Welcome back to the next episode. Thanks again.